Thanks everyone for coming. I'm going to start the program with trying to answer the question of what is lupus. But to do this, we're gonna go through this outline. We're gonna start with the introduction of what is our immune system. Then we'll introduce the concept of autoimmunity because that becomes important for this disease. And then we're gonna go through the main manifestations that patients with lupus have. We'll go through the different organs that get involved, and then finally we'll conclude with some points about the morbidity and the mortality that this disease has. So what is the immune system? In simple terms, the immune system is the group of organs and cells that everyone has in their body that protects them from any harm, any stressful situation. And this plays a direct role in things like vaccinations, or when you get an infection or an allergy, and also in autoimmune diseases, which is what we come to next. So what is an autoimmune condition? What this means is that immune system that you have that usually protects you from harmful things, all of a sudden gets impaired, gets confused, and starts attacking yourself, starts attacking your own body. So it can do that to different organs or different conditions that are based on this impairment in your immune system, and lupus is one of these conditions. So to further define lupus, it's a complex disease. The symptoms can vary widely from patient to patient, and it is unpredictable to know who is going to develop which symptoms and who's going to have a better prognosis versus not. So that makes the disease challenging and needing constant monitoring and so on. And I like to include this, what lupus is not, because I've found some people confused and thinking that it might be a contagious disease. It's not a contagious disease. You cannot get it if you're around a sick lupus person. You cannot get it sexually transmitted or with blood transfusion. It's not transmittable in any way. It is not curable either. However, the goal of treatment for this disease is to keep it under control. So when we talk about flares, which is when the disease is exacerbated, the times when you have a lot of symptoms, not feeling well, versus remission. So remission is what we want. Remission is when the disease is quiet, you have very few, mild, or no symptoms at all. So the disease kind of goes through phases. When you're in remission, you want to stay in remission, but it can go up and down, and you can go from remission to flare. And now we'll move on to the most common manifestations. So because I said patients can have very different symptoms, and because it can pretty much affect the whole body and all organs, it can be tricky for a person who's not really trained in this field to recognize this disease. So that's why it's important to pay attention to some of the classification criteria that have been developed that I think help physicians or even patients think of the condition and help get an earlier diagnosis, which is our goal. So from the American College of Rheumatology, the classification criteria includes 11 symptoms, signs and symptoms, and if you have 4 or more of the symptoms listed in this slide, then it's suggestive that lupus could be happening. But we also have to keep in mind that we have to always be ruling out other things that could be causing similar symptoms, because this is such a wide disease that can involve any organ. But pretty much symptoms such as different kinds of rashes, and then we're going to see some pictures, and it will be a better way to learn this concept, but rashes in the face, rashes around the scalp or the ears, ulcerations in the mouth, they can happen in the palate and the nose, arthritis, so a lot of joint pains. And I have here pericarditis and pleuritis. What this means is pericarditis is just inflammation around the membrane that surrounds the heart, and pleuritis is inflammation around the membrane that surrounds our lungs. So those can get inflamed. Also, it can involve the kidney, and in many different ways. It can involve the brain, and also it can cause different problems with the cells in your blood, such as it could be anemia, the white counts, which are the cells that fight infections, those can be low too. The platelets that are important for coagulation, And then we have some criteria that are antibodies. This means these are the last 2 points I have here. And what these are proteins that we measure in the blood that your immune system produces as part of the inflammatory reaction and so on. But it's pretty much labs that we can check also to screen and help with the diagnosis of the disease. Starting with the malar rash. Malar rash is this pattern of a butterfly-like shape in the cheeks, and if you see, it tends to spare this folds around the nose and the lips, and it can be very marked, like in the first, in the bigger picture we see here, and it could be very subtle, like in the picture over here. Could just look like red cheeks, but that's one of the most common rashes we see in lupus. And like I said, the ulcers can be anywhere in the mucosa of the mouth. They can also appear up in the palate, which is what we're seeing in this first image here. And other skin manifestations are the discoid lesions. These are lesions that are rough and they produce a scar. So the common areas where it happens is in the scalp. And when it happens there, hair does not regrow in that area because it just leaves a scar. It's common also to see those lesions in the ears. Those are the most common 2 areas. And then arthritis. So joint pain is actually the most common presentation for lupus. So it can be very debilitating, and it pretty much involves the hands with predominance and your knees. When you see it in the hands, you tend to see all the small joints involved, and it's not uncommon to have a patient with hands that look like this. You see that the hands are very flexible. They kind of, if you could imagine that this shape is like a swan neck, you see how extreme flexion they have in the fingers. So that's something that can commonly happen. And if you just reverse it, it will do that. It's not fixed, but you can reverse that. In that hand, and that can be very painful. Then moving on to serositis. We said this is just inflammation around the membrane that either involves the heart or the lungs. So when this happens, fluid can get accumulated. Whether if it's around the heart, then you can get fluid around the heart, and that can impair the way that heart pumps and give you chest pain or palpitations and problems of that nature. If the inflammation is around the membrane that involves the lung, can also accumulate there, and then that can give you pain with deep inspiration, you take a deep breath, or it can accumulate to a certain level that will cause shortness of breath and more problems. With the specific involvement of the membrane around the lungs, that happens in about almost half of the patients with lupus. It can be just one side, one of the lungs, or both. And it's usually, when fluid accumulates there, it tends to be small. But if it's not recognized and it's left untreated, it can certainly worsen and then get to the point of causing significant shortness of breath or needing to have that fluid taken out. So it's important to keep it in mind and recognize this. So it will cause chest pains, and these effusions are not very common as the presenting symptom for the disease, but it does tend to happen in most patients throughout the whole course of the disease at some point. It's also to point out other symptoms that it can happen with fever. Having this inflammation in the lungs can happen with fever, cough, and difficulty breathing. So it could be easily confused with a pneumonia. And since it's mainly young patients, then you can just probably get an antibiotic and not really get a full assessment. And that's when we get delays in the real diagnosis and treatment. And moving to a different organ, the kidneys. This is very important because up to 2/3 of the patients with lupus will have some involvement of their kidneys. It can happen in different ways, in different severity, but this is a vital organ, and when it's involved, it can lead to significant impairment and all the way to having failure of that kidney. So that's very important to recognize and treat also promptly. And with the involvement in the kidney, it also happens that we don't know who is going to have a mild disease and not progress to having more of kidney failure, and who is going to respond well to therapy. So we just have to be cautious and aggressive with every patient who has involvement of their kidneys. And I don't intend for you to memorize those slides, but it's just to point out that the involvement of the kidney can be very different. So it's always important when someone has lupus and has problems with the kidneys, we have to get a biopsy because that's the only way to know what kind of problem with the kidney is happening. And then that way you can treat specifically the problem that's occurring, because it could be different kinds of problems happen. And I said it can also involve pretty much any organ. So that includes the brain. And a good thing is that it's not very common to have very severe involvement of the brain in lupus. That's not very common. However, when you do have it, it can be pretty debilitating and result in high mortality. And you'll find series that say that the brain involvement in lupus is uncommon. It's only 14%. Some can go up to 80%, but it's because a lot of different symptoms in the brain can be a manifestation of lupus, and some of them are not that easy to recognize because it can go just from having, and I included this table, but a lot of different symptoms that you can have that can be just being confused, not being able to focus. Even something like that could be a symptom. It could be headache, and you can see how someone can think, oh, that this is something else. It's a migraine, or it's a virus, or something else. But it can go all the way to causing seizures or even psychosis, strokes, so it varies a lot here too. I wanted to include this about the labs, the positive ANA, because you'll hear that a lot, that this test is a protein in the blood, and a lot of people think that because they have that blood test, then they have lupus, but it is not like that. It is a good screening test, which means that practically everyone that has lupus will have that test positive, but it doesn't, the other way around doesn't apply. If you have a positive ANA, that blood test, that does not mean you have lupus. So it can happen with a lot of different things. It could be a virus, a chronic virus that you have that can give you that test positive. It could be some medications you're taking. It could be another autoimmune disease that it's not necessarily lupus, thyroid problems, so a lot of things. So it's important to know that because it can be very nerve-wracking to think that that test is positive, I have lupus. If we took one person out of 10 out of the street, one will have that test positive and not have lupus. And other manifestations that were not included in those 11 points of the criteria I showed first are more vague but are certainly common, and it's fatigue. So fatigue tends to be very common in lupus. It can be also debilitating. Sometimes it can be the main symptom, and we have to recognize it as well. Fevers can occur too. They tend to be low-grade fever or very high, and obviously we always have to make sure it's not an infection and not something else. So if you have lupus and you have fever, don't just think it's the disease. It could be the disease, especially if it's low-grade, but it could be also something else. We rule that out, and then we decide what we think it is. Hair loss can also happen, and this can be patchy hair loss, or it could be diffuse. Just thinning out of the hair is something that can commonly happen too. And something else, I don't think it projects very well, but it's purple, the changes in the color of the tip of the fingers, especially triggered by cold or stress, and that's called Raynaud's. But pretty much what happens is that the cold makes the circulation, the vessels that go all the way to the tip of the fingers get contracted. And then you don't get enough blood flow, and you see those changes in the color. You're going to see it goes completely white, purplish, red, and that can be very painful. And something else that could occur is blood clots. So about the morbidity. So we're saying all of these organs can be affected. So what is the end result of that? What happens with having all of these symptoms? So especially with the kidney disease and just the ongoing uncontrolled disease, you can have the lupus results in the leading cause of kidney disease in patients that are of childbearing age. So young women and having renal disease, strokes, and heart disease. So these things are major causes of mortality, And with the burden of disease throughout the years, this can result in this, especially if it's not treated appropriately. So we know that patients that are 35 to 40 years of age that have lupus have 50 times the likelihood of having a heart attack. And we know there's an increased risk for the formation of plaques in the blood vessels, and that's what we call atherosclerosis, and that's a major factor for this cardiovascular disease. Lastly, disability. So we're talking young population, and all of these symptoms and missing days of school or work and hospitalization, so that can also affect daily life significantly and lead to disability. And what about mortality? So it's much better than it used to be 50 years ago, which is a promising thing. 50 years ago, it would be that in the 5-year survival for patients that had lupus was 50%, so very, very low. But that has improved, and since the 90s is in the high 90s, so that's good, but still not as good as the rest of the population that doesn't have lupus. So still we have a 3 to 5 increased mortality in patients with lupus. So still a lot to do to try to lower that. And I want to leave you with some take-home points just to kind of refresh what we've been talking about up until now. And it's that to know that lupus is a complex autoimmune disease, meaning your immune system attacking your own body, and it can be manifested with a big variety of symptoms depending from patient to patient, but pretty much could affect any organ. And however, the most common initial symptoms tend to be the rashes that we saw in the pictures and the joint pains, pretty much the hands, the knees. These are the most common initial symptoms. And it's important to also keep in mind about 2/3 of the patients will have some involvement of the kidneys, so we're always monitoring for this as well. It would be good to know who is going to develop which symptoms, who's going to do well, who needs more therapy, but the prognosis and the course of the disease in lupus up until now, it's still unpredictable. We don't have the tools to know that. We do know, though, that the burden of disease can result in a lot of morbidity, mortality, and we need to diagnose the disease as early as possible to prevent that. To treat it properly, prevent that, close monitoring, making sure that everything is under control as much as we can. And I'll just like to conclude and leave this information in case you have any reason to come to our clinic. If you think one of these symptoms applies or just any questions, this is the contact information.